treat cavities as a rite of passage. We assume that dental care is unaffordable.
I've heard so many stories about poor oral health, which has led to many diseases such as diabetes, hypertension.
There's dramatic difference based on where you live, what type of insurance you have, what types of dentists you have access to in your community, the number of dentists you have access to in your community that can impact your outcomes and the ability to access care for the treatment you need if you're in pain.
Many people, they don't know about the extreme dangers in terms of if you don't take care of oral health and the impact that has physical and emotional and also in the development of the child.
We are so accustomed to having a lack of access to care that it's become our sort of norm, and we don't treat it as a crisis.
It's a national crisis. You know, I think when you have little kids sitting in school in pain and they have untreated disease, we're not talking about like little cavities, we're talking about kids sitting with 10, 15 teeth that are full of decay, then that's a crisis. They're not able to learn, they're not able to really focus in school. And, you know, it's something that is so easily treatable and preventable that, you know, I feel like that is a crisis that we're allowing that to happen.
Our systems are difficult to navigate in the best of circumstances. Trying to navigate things like insurance coverage, whether it's public or private insurance coverage, or even accessing, you know, figuring out how to make an appointment, figuring out which dentists are accepting new patients.
It's looking at that, how we educate the general public, especially minority population. Parents were telling us it's lack of information. I don't know nothing about this. I was not informed. I was not educated about this.
It is very important, it's very vital that we work together to help folks understand from that little baby growing up and raising your children the importance of oral health, making sure they are getting the proper nutrition, going to the dentist, flossing.
As we've traveled around the state and done our work to work with communities to understand barriers to good health in their community, the biggest challenges they experience, oral health came up time and time again as one of the top 1, 2, or 3 concerns in communities. And that's where the Oral Health Collaborative has come in, is it's sort of given voice and a home to all of the various advocates who want to work on oral health.
It's just like a 60, 70-year process, and I just see that things are changing.
10 years ago, we didn't have a lot of hope around the types of change we could achieve, and that's changed dramatically. What we have is a lot of people from diverse stakeholder groups, including patients, including parents, including teachers, including all sorts of provider types who are interested in improving oral health in the state, and they can now begin to see a path forward to do that.